Hello, good afternoon, everybody. Welcome to the live public health talk, our first from the Shoulder Center. My name is Dr. Harshad Javalkar. I am the consultant shoulder and upper limb orthopedic surgeon, and I am joined by my colleague here, Dr. Pawan Kumar Talupuru. He is our senior sports physiotherapist, and I am pretty positive that the diabetologist, Dr. Jeff Akash, who is a close friend of mine, will also be able to join us. Unfortunately, he had to leave town for an emergency. We are hoping that he'll be able to join us live from the remote location in a short while. We are hoping that this will be the first of the number of patient education initiatives that we have started. And let me begin by introducing myself. I am a consultant shoulder and upper limb orthopedic surgeon. I did my MBBS from Gandhi Medical College, and after working for a number of years in medical colleges, I went to London in King's College Hospital, where I did my fellowship in shoulder and upper limb surgery from 2015 onwards. In 2018, I returned from the UK and started my practice back in my hometown in Hyderabad, which is where the Shoulder Center has been set up. The Shoulder Center aims to deliver quality, state of the art care for all shoulder problems. This is an innovative concept pioneered by the many in the US and in the UK, but is relatively new in India. So we aim to give quality treatment for all problems regarding the shoulder, whether it is surgical or non-surgical, and it is individualized to the patient. Okay, without further ado, let me introduce the speakers. Today we have, I guess I'll have to share the screen now. Just give me a minute, please. There we go. All right, so our first speaker today, if he's able to join us, would be Dr. Jeff Akash Sai. He is a good friend of mine. Apart from that, he is also a senior consultant diabetologist with many, many years of experience treating diabetes. Presentations and has also won many awards for his service to the community for the diabetes. I'm really positive that he will join us from the remote location. Um, our next speaker is Dr. Pawan Kumar Talupuru. He is the senior consultant physiotherapist at the Shoulder Center. He is a man of national and international experience. Currently, he is the head consultant physiotherapist for the Delhi Ranji team, and he has been the Ranji team physio for Punjab, UP, Manipur, and also for the India B cricket teams. Uh, I'm sure you'll be speaking to him, you'll hear him talk, you'll be able to ask him your questions once we talk about the physiotherapy. So the reason we wanted to have this talk is to give the general public, the layman, a comprehensive overview of frozen shoulders. So there are a number of problems which can affect the shoulder, and frozen shoulder is one of the common ones, and it also causes a lot of pain, stiffness, and therefore disability to the patient. This is a very simple, straightforward diagnosis which can be improved by the proper treatment. So the purpose of the talk, the outline of the talk would be to give an introduction and overview of the frozen shoulder. And there are three different specialists who are involved in the treatment, three different modalities for treating this. Of course, the orthopedic surgeon is always there, but the physiotherapy angle, which will be talked about by Dr. Pawan, and the control of the diabetes, which is also very, very essential. So that is going to be spoken by Dr. Jeff Akash Sai. And remember, this is a live session. This I want to be an interactive session. So please feel free to ask any questions. You can ask questions by typing them directly into our text box by comments on our website www.theshouldercenter.com. The center is spelled with an RE at the end, not ER. So it's theshouldercentre.com/live. You can also ask questions on the comment section in YouTube and on Facebook, on which we are live. And you can also call us up on the number or SMS or WhatsApp if that is what you prefer. So please feel free to ask any questions that you have. So I have to begin. So as all of you must already be knowing, the shoulder is a ball and socket joint. The arm bone is this one. It has the ball on top, and then the shoulder blade, which is this part, it has a socket. So naturally, the socket is very, very shallow, and the ball is quite big relative to the size of the socket. So it is a finely balanced joint which needs lots of soft tissues to support it from the front, the back, the top, to keep the big ball in this shallow socket. I'm so sorry. So this balance depends quite a lot on the soft tissues which cover the joint. So in the center of the screen of my PowerPoint, you can see the joint capsule, which is the first layer of soft tissues which invests the shoulder joint. This capsule needs to be flexible. It is a tough structure, but at the same time, it is also an elastic structure. So in normal people, this capsule can stretch. If you imagine the shoulder joint moving, the arm going up, the capsule allows that stretch and allows that movement to take place, and at the same time giving stability to the shoulder joint. So this is the culprit. The joint capsule is the culprit in most of the cases with frozen shoulder. On top of this layer of joint capsule is a covering of muscles, which is known as the rotator cuff. So these muscles, they start from the shoulder blade and then they go in front, the back, and on top of the shoulder, and they pull the ball into the socket joint. In fact, they hug the ball and pull it into the socket. So this muscle layer is usually intact in isolated frozen shoulders. So going on to the next slide, the image in the center, this one, is the normal joint capsule. In frozen shoulders, it becomes thickened, it becomes inflamed, and it loses its elasticity because of tough fibrous bands known as adhesions. So because of this, what is a normally white, smooth, elastic structure, as you can see from the image on the top right hand side of the screen, which is the image when I put in the camera in arthroscopy, that is a normal capsule. But in frozen shoulder, it becomes inflamed and stiff. That is the reason why we call it adhesive capsulitis. In technical terms, frozen shoulders, pure frozen shoulders, are known as adhesive capsulitis. And this in turn causes a lot of pain and stiffness. So the next logical question you would ask me is, why does the shoulder freeze? A normal joint, why should it all of a sudden become painful and stiff? Why should the capsule become inflamed and painful? The answer, unfortunately, is that no one knows for sure. There are lots of different etiologies, lots of risk factors proposed, but we don't know why this happens. Age above 40 years makes you predisposed to have a frozen shoulder. It is more common in women, and if the shoulder is immobilized or it has lost its capacity to move due to any reason, it develops frozen shoulder quite easily. So some common causes of immobilization of the shoulder can be an injury around the shoulder or the upper limb, which is the elbow and wrist, or it could be a surgery around the shoulder joint, or it could be a stroke in which the muscles which move the shoulder and the upper limb are paralyzed. It is also very, very common in diabetics. It does not matter how long you've had the diabetes or how well or poorly the diabetes is controlled, but diabetes is an important risk factor for developing a frozen shoulder. Similarly, thyroid dysfunction and heart disease also predispose to frozen shoulders. So when you come to us, when a patient comes to me with a frozen shoulder, how do I diagnose him? How do I make sure that he is suffering from just a frozen shoulder and not some other pathology of the shoulder? Say, for example, a sports injury like a rotator cuff tear or a damage to the cartilage, which is the labral tear, or anything else. There are lots of things that could go wrong around the bones and the soft tissues around the shoulder. So my answer to that question would be, I'm sure Pawan here will agree with me, that the thorough history and clinical examination is one of the most important things to assess and diagnose the problems around the shoulder. So there are lots of different techniques which we use. It includes provocative tests. It includes a thorough history, and in Pawan's case, which is a lot of physical assessment to assess each individual muscle group and then how to take it forward. So after the clinical examination, we usually ask for a basic X-ray of the shoulder. So this will help us confirm that there is nothing wrong with the bone and the joint, and that the problem is only with the soft tissues. So in the majority of cases, it is to rule out other conditions like arthritis of the shoulder. And in some cases, some patients in whom the pain does not respond, we also go for further investigations like an ultrasound scan and an MRI scan. I'm sure all of you might already be knowing what the advantages and disadvantages of each are. We will go into that in a while. So when it comes to treatment of a frozen shoulder, I want to emphasize some basic facts about the frozen shoulder. The good news, I'm sure all of you are happy with that. The good news is that it is usually a self-limiting condition. That means if your diabetes is under control, then even without any specific treatment, without any formal treatment, pure isolated frozen shoulders usually get better on their own. How long it takes to get better? Nobody knows. It depends on each individual. It depends on a lot of factors, but my experience and literature corroborates the same thing, that it might take anywhere from 6 months to 4 years for the symptoms, that is the pain and the stiffness, to get better. When I give this information to my patients, they are a bit uncomfortable because it is very, very unpredictable. Nobody can answer the question how long exactly it will take. It might take anywhere from 6 months to 4 years, which is a very, very big interval. So the goals of treatment is to achieve pain-free, full movements of the shoulder. So pain, whenever it occurs, whether it is when you're combing your hair or when you're trying to reach behind your back or to reach overhead, or whether it is in your sleep. So lots of patients have pain in their shoulders when they lie on the affected side. So good pain relief is one of the aims of the treatment, followed by full movements. Not full, but as near normal as possible movements. So you should get frozen shoulders treated because the recovery is faster and the outcome is more predictable with formal treatment of frozen shoulders. So treatment involves lots of things. So it is usually a step ladder pattern. It is individualized to each patient upon the demands, upon the requirements, about the in which how severe the symptoms are, how severe the disability is. But in general, and we will cover all of these in a stepwise fashion. Physiotherapy and medication is usually the first part. Medication can be usually very simple medication, over the counter drugs, paracetamol, aceclofenac, tramadol. Along with that, physiotherapy is the key, which Dr. Pawan will cover in a short while. Along with that, if these basic things fail, then we have the option of giving injections into the shoulder joint. It could be a steroid injection or it could be an ultrasound guided hydrodistension. So I will talk about this after Pawan has spoken about physiotherapy, after he has shared his expertise with us. And when it comes to proper surgery, from the orthopedic surgeon point of view, when it comes to surgery for frozen shoulders, there is only one surgery, which is arthroscopic capsular release. Previously, they used to do an MUA, which is known as a manipulation of the shoulder joint under anesthesia. Historically, this used to be done. Nowadays, in the West, where I did my fellowship in London, it is only of historical interest because it has some inherent problems. And of course, I cannot emphasize more that diabetes control is probably one of the most important things which you can do to help yourself. So let us speak to the experts. Unfortunately, Dr. Jeff Akash Sai is still not able to join us from his remote location. So I would like to invite Dr. Pawan Kumar Talupuru, our chief physiotherapist, to share his expertise with us. He is, like I briefly mentioned, he is a man of national and international repute. He has accompanied Indian cricket teams to international level tournaments as well. And we are lucky to have him at the shoulder center. So I request you, Dr. Pawan, to please kindly take over and talk about frozen shoulders from the physiotherapy point of view.
Hi everyone, good afternoon. Thank you, Dr. Harshad. I'm very glad to conduct this Facebook Live. I'm going to talk about the frozen shoulder physiotherapy aspect. So just a minute, I'll share my screen.
Please bear with us for a minute. I think we are experiencing a minor technical issue. Oh, it was me not muting my camera, mic.
Can I start my presentation?
Yes, please. Yeah, go ahead, Tom.
Today I'm here to talk about frozen shoulder and in perspective of physiotherapy perspective, like how to relieve pain and regain movements. Actually, these are the problems every patient, frozen shoulder patient, will have the following list of problems like pain in functional activities. Most common movement they lose like flexion, which is front elevation, whereas abduction, side elevation, and rotation, external rotations of shoulder. These are the commonly movements which is affected. Because of that, they will have a difficulty in daily activities like overhead activities, hand behind back activities, and they will also have a problem in like sleeping on affected shoulder. And finally, they will have few patients will have a depression due to their kind of lifestyle with pain and loss of movements. Our main aim of rehabilitation is to regain pain-free functional movements, which is full natural movements, full range of movements, gain a normal strength and shoulder stability, and to achieve ADL activities, the daily living activities. So there are so many conservative treatment apart from medication. We have a physiotherapy part of treatment. Mainly we concentrate on pain and range of motion. To reduce pain, we have certain modalities, electrotherapy modalities like TENS, IFT, wax bath, ultrasonography, laser, hydrocollateral packs, and hot packs. These are the common instruments which we'll use to reduce the pain intensity of pain, and then once the pain get reduced, then we'll start work on range of motion and the strengthening and stability of shoulder joint. So to regain shoulder ROM, like the physiotherapist will do like mobilizations, which is done by the therapist, and one more form of treatment is like dry needling technique, where we use acupuncture needles to release trigger points in surrounding shoulder joint muscles, as well as to relax the tightened muscles. And one more treatment technique is like fascia mobilization. The fascia which is covered on muscle, even that is also a cause for this adhesions around shoulder joint. So we'll mobilize fascia, and there is a corrective technique which helps to correct the posture, like we'll be activating or deactivating certain muscles by taping techniques, and these are the techniques performed by the physiotherapist. Whereas the patient can do certain mobility exercises, stretching exercises, stability exercises. These are the main exercises which the patient has to perform daily, at least weekly, thrice a day, so that they can improve their mobility, they can improve their strength, and they can improve their stability. Generally, if you come to recovery, it will take 6 months to 4 years for total recovery of most severe cases of frozen shoulder. Whereas with post-injection rehab, we can go for rehab around 4 to 6 weeks of rehab time. Whereas post-surgical rehab, it will take 6 to 8 weeks of rehab with active physiotherapy and lifestyle modification. How to prevent these frozen shoulder? Generally, you all know that diabetes is one of the risk factor. So after crossing age of 40 years, especially females are more prone to this kind of problems. Even men's also prone, but mainly females are more prone due to hormonal imbalance, as well as diabetes and decreased range of motion after an injury, shoulder injury. These are the common causes which can cause this shoulder. So we can do a regular exercises. Keep in eye like functional activities, like we should not have any pain or activity limitation due to pain or due to lack of range of motion. So we need to regularly do strengthening exercises for shoulder, and then early diagnosis can prevent severity of injury, so that most of the patients will recover within 1 month to 6 months if it is less severe. If it is more severe, then it will take a longer time. So it is better, early diagnosis is the key factor to prevent injury or severity. These are certain exercises I will show you for frozen shoulder. He's one of our senior most physiotherapists, Dr. Praveen. He just showing few exercises. You all can watch. These are shoulder mobility exercises. Generally, when you are fine, like without any problem, so it is better to do daily routine fitness workout with shoulder range of motion exercises. These are shoulder mobility exercise. If they are suffering from frozen shoulder, the range can't be full. They might be having a problem in doing these exercises. They can limit the range. These are another exercises which is squeezing the ball, which is isometric exercises, and followed by the another mobility exercises like uh, rolling the ball in a clockwise, anti-clockwise direction, up and down. So here you are going to move shoulder joint as well as scapulothoracic joint. These two joints play a major role in shoulder mobility. This is the one more isometric exercises which you can hold it. You can hold the muscle. You can contract the muscle for a few seconds and then relax. So here he is doing an external rotation with isometric exercises. This is an internal rotation with isometric. This is in sideway position. You do ball rolling, ball pressing, and ball rolling up and down, and clockwise and anti-clockwise direction. These exercises, like initially, they will have a less range of motion, but as joint moves on, the synovial fluid production will be increased, and in that way it will help for mobility. These are some stretching exercises where you need to stretch your front muscles, front shoulder muscles. Generally, these front muscles are tight, so that you need to stretch. The principle is you need to stretch the tightened muscle and strengthen the weakened muscle. So the front end muscles are tight, back muscles, scapular muscles are weak. So this is another way of stretching. Corner, like corner you do it. You need to hold for 20 to 30 seconds stretch, and 3 to 5 repetitions you can do this. And this is one more exercise, which is mobility exercise, shoulder mobility exercise, where with the help of stick you are going to perform this. And these are TheraBand exercises, which it will provide an resistance. One is front elevation and one is side elevation. And yeah, this is one more exercise. Thank you very much. These are the common exercises which you can routinely perform at your home or at the clinic. These exercises can help you a lot. It gives a better result. It will give relief from pain, and it will increase your range of motion. Thank you. I am going to hand over to Dr. Javalkar, sir.
Right. Thank you. Thank you so much, Pawan. That was a very good demonstration about the importance of exercises and how to do them. Okay, I have a few questions for you. I'm sure the audience also has quite a few questions for you, but we will come to the questions towards the end of the talk. Unfortunately, my staff is still not able to get through to Dr. Jeff Akash. I think he's busy. He's a busy man, and like I said before, he's had to attend an emergency meeting. So unfortunately, he will not be joining us today. We will aim to
repeat the talk with him sometime in the future. Unfortunately, we will have him back into one of our live talks at the Shoulder Center sometime in the near future. And let me continue from the orthopedic point of view. Right. So as a dedicated shoulder and upper limb orthopedic surgeon, I have to re-emphasize rather, that this is a self-limiting condition. And the first step of treatment is usually proper physiotherapy, along with some temporary painkillers. But some patients who have severe grade of capsulitis or who are not happy with their shoulders despite a good reasonable trial of physiotherapy for a few weeks to few months, then we can progress to the second step of treatment. So in the UK, in London, where I trained, even now here in some of the centers, we have very good musculoskeletal radiologists who do an ultrasound of the shoulder to check whether there is something else going wrong with the shoulder and give an injection into the shoulder. So this is me performing an ultrasound scan. So I'm actually doing an ultrasound guided hydrodistension procedure. In this patient, I have inserted a needle into the shoulder joint, inside the shoulder joint. The ultrasound helps me accurately position the needle. It increases the precision of the needle, the location of the injection. And through this injection, depends on whether the rotator cuff is intact or not, we can do just an injection of a small dose of steroid, which will temporarily help in reducing the pain and the inflammation of the capsule. Or we could do another procedure which is known as hydrodistension. In this procedure, if the coverings of the shoulder joint are intact, then I attempt to inflate the joint. That means try to blow up the joint capsule, something like a balloon. It's not as dramatic, but to inflate the shoulder joint capsule with saline, local anesthetic, and steroid. So in some patients, this can help. This is a temporary measure, this to reduce the pain. Once the pain is reduced, then they will have to go back to their rigorous physiotherapy regime. In patients whom injections also fail to occur, or if they need more than 2 or 3 injections, because you cannot give lots of injections also, they have their own risks. Some of the risks, one of the major risks is infection of the shoulder joint. This can especially occur in diabetics. So as a rule, we have to be very selective about not only the location of the injection, but to whom we are giving and how is the diabetes controlled when we are giving this injection. So it has its own risks and it has to be given by the expert. So the ultimate treatment for frozen shoulder, if all the other measures fail, is surgery. Surgery usually means, or patients, they think that it is a big butchery. I have heard a patient use that word to me. It is not butchery. And the latest that we do right now is arthroscopic capsular release. So this is a very specialized, minimally invasive painless procedure with hardly any blood loss, and it just needs 2, 3, maybe 4 stitches, tiny stitches. So I'll talk about the arthroscopy procedure in a while, but specifically for refractive or painful frozen shoulders in a very small subset of patients, arthroscopic capsular release is an excellent option. So the advantages of surgery are that it is a very controlled, and a precise procedure. We know exactly what we are doing. There is no blind guessing. No, okay, the injection might work, it might not work. Some people it works. There is nothing like okay, we might be dealing with some other problem of the shoulder. Maybe it's arthritis. Maybe it is rotator cuff tear. Maybe it's got a long head of biceps inflammation. So we have, with this procedure, we can assess the whole shoulder in toto from inside and do exactly what is needed. It is minimally invasive. That means through small, tiny cuts around the shoulder, they're just barely a centimeter long. So through tiny cuts around the shoulder, I introduce pencil-sized instruments into the shoulder joint, a camera and instruments, and then do whatever is needed. So here, the second image, the blue image, the blue drapes is the procedure being performed. This procedure has another added advantage of dealing with all intra-articular and extra-articular adhesions. That means the tightness, the tight bands which form within the capsule, they can be properly released. It can also assess and address other problems. So if there is some other compression at the top of the shoulder, if there is subacromial impingement, that can also be decompressed by this procedure. And literature has revealed that specifically for frozen shoulders, the recovery time is faster, it has better pain relief, and the results, the outcomes are more predictable as compared to the older types of treatment which involves manipulation under anesthesia and the like. So how exactly is the surgery done? This is formal surgery, this is major surgery. You will be given anesthesia, and that means that blood tests, x-rays, heart assessment, general body health checkup, a pre-anesthetic checkup has to be done, and then the anesthetist will either numb your shoulder and your upper limb, that means numb your hand so that you're comfortable, or he might choose to give general anesthesia. It depends. It depends on a lot of factors. If the patient has any other problems, then he might choose to vary the anesthesia. But in general, the hand will be numbed. So this is known as a block. Once he gives me the green flag to go ahead, then I will position the patient. The patient is sitting on the operation table, and then I introduce my camera through small, tiny cuts around the shoulder. Along with the camera, I also introduce all the instruments that are necessary to assess the shoulder. So I take a good look at all the shoulder joint, the entire joint, live. So instead of assessing indirectly with an ultrasound or an MRI, which can be wrong, the diagnostic accuracy of arthroscopy is pretty high. So once I put my camera in, I assess the entire joint. The images, as you can see in the bottom image, I can see the inside of the shoulder on a screen which is right in front of me. So it will help me look at other problems around the shoulder. It has known to happen that in some patients, capsulitis can be the result of another injury in the shoulder. So for example, a rotator cuff tear or a labral tear can present with capsulitis. So with this surgery, I can assess the shoulder joint from inside. So during the surgery, so the image on the right, you can see from the left is the arthroscope, this one. This is the camera, and this is the probe. So through which I actually assess and then I release the tight structures. So there are a few ligaments and along with the capsule which are tightened in frozen shoulder. And this is an illustration of how the capsule is released by arthroscopy. So next questions my patients ask me is what are the results of surgery? Is it useful? Is it needed? Does it help? So my response to that is the surgery should be done by the right surgeon on the right patient. So as long as the patient understands what he is getting into, as long as he is clear about what the outcomes of surgery can be, and he is in need of surgery, he has genuine pain which is disturbing his activities of daily living, if he has had a course of really uh, proper physiotherapy, only then I offer the patient surgery. So the right patients, majority of them do well with surgery. The rate of recovery is faster and the pain relief is also much better with arthroscopic surgery. I'll have to re-emphasize again that surgery alone is not the answer. It is like a combo package. So if you want to go ahead with surgery, then you have to follow physiotherapy protocols meticulously. So it is not just the surgery, but also the physiotherapy before and after the surgery that is important in ensuring success of the procedure. Always an element of luck, which we try to minimize, but a small percentage of patients have some complications of the shoulder, which could mean that they might have some residual pain and stiffness around the shoulder. It all depends on how well they manage their blood sugar levels and also how compliant they are with their physiotherapy protocols. So here is an example. This is a young lady. She is 50-year-old, typical patient profile and an age group in which frozen shoulders can occur. So she came to me almost a year after she started having this pain. She had her family physician who had referred him to an orthopedic surgeon, and they had tried injections into the shoulder joint. And she has an excellent in-house physiotherapist also. So she failed all these things. So she failed physiotherapy, she failed injections, and then I offered her surgery. And this is the result of about 2 months after an arthroscopic capsular release. Okay, there's some lag time. Let me see if I can play the video. Yeah. Right. So she's about 2 or 3 months after the surgery, and as you can see, we are talking about the right shoulder. So you can see the excellent range of movement she has achieved with surgery, and like I said, she is a very good patient. She was under control, and can you see this? Can they see the video? Ah, okay. No, no, no. Let me. Sorry. Now, can you see? Yeah. Okay. Yeah. Right. So the lady I was talking about. Sorry, the video wasn't playing when I was talking. So we're talking about her right shoulder, which was pretty stiff and pretty painful to begin with. But this is her about 2 to 3 months after the surgery, and she's quite happy. All right. So I think that brings me to the end of my talk. Yeah. So uh, hope we have covered, both of us have covered the basics about frozen shoulder. Um, I believe we have a few questions from the audience.
So we'll start
So we
taking
start
audience
taking
questions for now.
audience questions for now.
So Mr.
So
Vijay,
Mr. Vijay, he specifically asks me, I am a sports person. Am I at a risk of frozen shoulder? Hi Vijay, thanks for watching. Thanks for the question. Well, like I said, there are a few risk factors for developing a frozen shoulder. For a sports person like yourself, the only risk factor is that if you injure your shoulder, and then it doesn't get the appropriate treatment, then you can develop secondary adhesive capsulitis. But for the general public, like I said, diabetes, immobilization, cardiac problems, women in their 40s and 50s and beyond. So these people are more likely. But in your case, if you take all the preventive measures like Dr. Pawan has demonstrated, if you take care of your shoulders to make sure that you prevent any sort of undue injury, and then if you have an injury to your shoulder, you get the appropriate treatment, that you are not in the risk factor, you are not in the risk group for having a frozen shoulder. Hope that answers your question. Next question is from Mr. Joydeep. Hello, Mr. Joydeep. So this is for myself and Dr. Pawan. So Pawan, I want you to, I mean, if you can answer this question, that will be great. I'll
afterwards.
afterwards.
So he asked, Mr.
So
Joydeep
he
asks,
asked,
we are out of the game for 5 months now. Any advice to avoid
Any
injury?
advice
That's
to
a very
avoid
good question.
That's a
Yes.
very good question. Yes.
Prevention of injury is
Prevention
critical.
of
Over to you, Dr. Pawan.
Over to you.
Yeah, because of COVID conditions, it is difficult for you people doing a regular routine exercises, fitness programs. So due to this, there is chance of risk for upcoming season or upcoming tournaments. So you need to have a proper assessment, pre-participation assessment to be done by a physiotherapist and by your orthopedician. Then once they check your range of motion, they will check your mobility, they will check your strength, stability. Basing on that, they give a prehab program, and then you need to follow that prehab program to prevent further. So, yeah, this is my advice
Yeah.
to Jaideep.
Yeah.
All right, perfect, perfect.
All right.
That's very
Perfect.
good.
Perfect. That's very good advice. That's very good question. So make sure you follow your
Lockdown. Take care of your shoulders
take care of
by doing
by
regular
doing the
stretching
stretching
exercises, by
exercises,
doing
by doing
pre-op and
pre-op
post-op,
and
sorry,
post-op pre
workout and
workout
post-workout
and
warm-up and
post-workout
cool-down
warm-up,
sessions.
cool-down section. Uh,
Usually, I
Usually,
suggest
I
that you
suggest
do
that
dynamic
you do
stretching
dynamic
before your workout
for your
and you
workout
do
and
static
do
stretching
static
after your
stretching
workout.
after
So
your workout.
dynamic means
So
in
dynamic
which there
means
is
in which there
movement
is
of your shoulder.
movement
So
of your
this
shoulder.
would
So
be a
this
dynamic
would be
stretch.
a dynamic
And
stretch.
say for
And
example
say
this
for
would be a
example this
static
would
stretch.
be a static
So
stretch. So
it's less into technicalities,
less
but in general,
technicalities, but in general,
keep active, keep
keep
moving your
active,
shoulder
keep moving your
and
shoulder,
make sure
and
you're stretching
make sure you're
regularly.
stretching
So that
regularly.
is the main thing you
So
can
that
do to
is the main
prevent
thing
your
you can
shoulder.
do to prevent
And of
your
course,
shoulder.
if you
And
have
of
any
course,
more
if you
questions,
have any more
come see a
questions,
good
come
physiotherapist.
see a good physiotherapist.
Next question we
Next
have
question we
is
have
from
is
Miss.
from Miss. Next question we have is from Miss Darshan Kaur. Hello, Darshan. How to reduce pain when it triggers with daily living activities? Okay. I know. I mean, this is a very common question, especially during COVID times. Not much of domestic help available, and then women have to do their own household chores. Um, well, you have to rest it. Unfortunately, if activities of daily living are triggering the pain, um, rest is needed. But if rest is also not helping, if rest is also not helping, then maybe you can try some home medications like combiflam, aceclofenac, those sort of medications temporarily. But if it is not settling down, then you should definitely come see an expert, either an orthopedic surgeon or a physiotherapist. Get yourself assessed, and then maybe we will suggest you some further investigations like X-rays, ultrasound, MRI scans to just see what is going on. And usually, in the majority of the patients, proper rest, medication, physiotherapy usually does the trick. But if it is not helping, then you might need to step up the treatment with either injections, or if the pain is bad, then maybe surgery. She also asks whether cervical disc bulge and compression leads to frozen shoulder pain. No, these are two different entities. The cervical disc bulge, that means a slip disc, and a frozen shoulder are two complete different things. It is easy to get confused whether the pain around your shoulder, around the back of your neck, is coming from a disc bulge, from a cervical spondylosis, or a cervical slip disc, or from a frozen shoulder, because the nerves, they start from the neck, they go down the shoulder in the muscles, and they go down the hand. So a good clinical examination will, by a specialist, will usually differentiate whether the pain is coming from a cervical disc bulge or whether it is coming from a frozen shoulder. One simple way to test yourself if you have frozen shoulder or not is to check for shoulder movements. Specifically, if you look for shoulder movements, if they cause pain, it is likely that the pain is coming from your shoulder. If, on the other hand, if you do your neck movements, when you move your neck, the pain is worse, that means the pain is from your neck. It could be a cervical disc prolapse or compression, like you were calling it. I hope this answers your question, Darshan. Do you want to add anything on that, Pawan? Okay.
And there is one more question.
Jeff?
Yeah, go on.
Yeah.
Yeah.
Could you advise some shoulder exercises to be done as a preventive measures? Yeah. If you have shown my presentation, you would have seen certain mobility exercises and strengthening exercise, which is done with TheraBand, and active exercises, which is normal range of motion exercises, which you can do like a simple rises, side rises, rotations. These are the normal mobility exercises. Apart from that, you can do certain strengthening exercises using TheraBands as well as lightweight dumbbells. So with this, you can do preventive program. So if you want a detailed program, you can consult your consult physio so that you can take a program and you can work on it. This is my I don't know name who asked this question. I think you got answer.
Long. Okay, sorry, bear with us. We're trying to check for more questions. I believe there are a few more questions on the website. Okay, when is it live? I think this was an older question. Yes, it is live now. Okay, Mr. Viju. Okay, we have a few more questions. Mr. Viju says, I am an avid sports guy. Am I at risk of frozen shoulder? No, I think, yeah, this was by Mr. Viju. I have already answered this. Mr. Joydeep has done. And Mr. Karthik, Mr. T. Karthik, hi, thanks for watching, Karthik. I have severe pain in both knees. I play squash and football. What exercises do you suggest at home? As I don't hit gym or club anymore due to the pandemic. Yeah, I think, yeah, none of us are going to the gym or the club anymore. Exercises for knees. Well, both your sports are heavily into impact. So both squash and football are pretty hard on the knees. So you will need proper conditioning of your knees. So as of now, I think you can answer this, Pawan. But my 2 cents about it is that you should make sure that your quadriceps and your hamstring muscles are toned really well. So if you have any weights at home, maybe you can start using the weights around your ankles and do quadriceps and hamstring exercises and also stretching. But I'm not the expert. Dr. Pawan will answer your question right now.
Yeah, you can do exercises for lower limbs, especially squatting exercise is to be done. Squatting exercise is to be done for quadriceps, whereas for hamstrings you have to do deadlifts exercises, and then ham curl bridge. These three exercises are very good for your lower limb muscles, so which can prevent injuries. Okay, I hope I answered your question. Next.
Right, Pawan. I think I might have a few questions for you.
How important
How
is
important is
stretching?
stretching?
So, like you
So,
said,
like you said,
let me rephrase that. How
let me rephrase
important
that.
is
How important is
stretching the shoulder
stretching
muscles
the
on the
shoulder muscles
front
on
of your
the
shoulder?
front of your shoulder?
So,
So,
my take on it
my
is
take on
that
it is
because
that
of modern
because of
lifestyle,
modern
the
lifestyle,
shoulders
the
tend to come
shoulders
forward,
tend to come forward,
whether it is
whether it
typing,
is
whether it is
typing,
riding,
whether it is
driving,
riding,
reading
driving,
a book,
reading
reading
a
a
book,
newspaper,
reading
whatever
a
it is.
newspaper,
The
whatever it is.
shoulders tend to
The
come
shoulders tend
forward.
to come forward.
Do you think that is an
Do you
important
think that
factor
is an
in
important
causing
factor in causing
tightness of the
tightness
shoulder
of
muscles
the
in the front
shoulder muscles
and
in the
maybe
front
weakness of
and
the
maybe weakness of
muscles in the
the
back?
muscles in the back?
Yeah, because everything what we do in a front side. So we generally neglect our scapula or back muscles. So for any muscle to be healthy or any joint to be healthy, we need a balance between two groups of muscles. So we need to stretch the front muscles which are tight, and we need to strengthen the back muscles which are weak. So in that way we can correct the posture. And you asked me about the stretching, how it is important. See, generally in olden days, people used to do sports. People especially they used to do warm up and cool down, both static stretching. But recent research says that warm up should be done with a dynamic stretching, and cool down or warm down should be done with static stretching. Uh, these stretching
The
plays a
stretching is
major role
a major
because
role
it helps
because
to
it helps to metabolize the
metabolize the
metabolize
waste which is
waste.
generated at the end of the day after an workout. I hope I answered your question, doctor.
Oh yes.
Yes. Oh, yes. Perfect. Right. Thanks, Pawan. Okay. There's a question from Miss NR. I don't have the full name. I just have the initials. Our team is working on trying to get me the full question, but I can see only part of it. So it says, okay, we have it. We have it. Thank you. Okay, Miss NR, hello. She says, I'm a working woman. Most hours have to work sitting. Can you please guide me with the postures to be maintained, and please let me know further what all I need to take care of? Okay, excellent question, NR. I mean, there's some issue, I think, with my stream. I am not able to see your question. We are not trying to ignore you. Um Yes, that's a very pertinent question. It's a very important question. Most of the patients that we see are having a desk job. So it usually entails sitting for long hours of time, and it causes a lot of problems, not just in shoulders, but back, knees, neck, you name it. Even, I mean, desk job, computer workers, they have carpal tunnel syndromes, cubital tunnel syndrome. So our modern lifestyle, unfortunately, is not too good for our general health. So I'm going to answer the first part from the orthopedic point of view. The second part, I'm going to ask for Pawan's input also. So the general rules are that maintain your spine as straight as possible. So when you're sitting up or when you're standing, keep your head squarely on top of your shoulders of your back. If you're standing, stand as if your back is against a wall. That means the back of your head, the back of your shoulders, your buttocks, and your heels are in one straight line. When you're sitting, do not slouch, do not even recline. So try to keep your spine as vertical as possible. If you drop your earrings, they should fall on your shoulder, they should not fall in front. So these are just some tricks to improve your posture. Every half an hour or 45 minutes at the most, you have to get up, you have to stretch. Maybe you can go for a drink of water, or just do some basic stretches, walk around your desk and come back and sit. Sitting for a prolonged time beyond 45 minutes, half an hour to 45 minutes is bad. It's bad for all muscles. So sitting, it's called the sitting pandemic. Obesity is caused by the sitting pandemic. So lots of sitting for prolonged times can ruin your system. I'm sure there will be some tricks about how to sleep also. I'm handing over the mic to Pawan now.
Yes, this is a very common problem nowadays we see in software professionals or those who are sitting for long hours, or like throughout the day they will be working hard, and they are doing like sitting job. So they have lots of problems related to neck, back, wrist. So I advise them, those who are doing sitting jobs, they have to give at least half an hour a day. They have to give for some exercises. Either you do Surya Namaskaras, or you do go to gym, or you do a jogging, walking, whatever kind of activity you have to do daily half an hour. Then that will give a good result, that will prevent certain injuries, those who are sitting for longer hours. And it can also help their number of working hours will be performed with a better performance. They can do better performance with daily half an hour exercises. So there are lots of exercises. Like if you don't want to go to gym, just do core exercises, which like body weight. You can use your body weight and you can do certain exercises, certain mobility exercises, certain core exercises for abs and back. So there are lots of body exercises are there, which you can do so that you can prevent certain injuries in software professionals. We generally come across so many software people, they come to our clinic with neck and back issues. So, and also we can do ergonomic advice. We'll give ergonomic advice to adjust their seat height, to adjust their table height, their laptop height. The laptop should be eye level, and they should have a support of elbow while typing on laptop, and they should be like the laptop should be at eye level, and the spine should be straight. They should not sit on a cushiony things. They should sit on a firm thing, so that it will give better relief. I hope I answered your question.
Yeah.
Thank you.
Absolutely.
Yeah, that's plus. I mean, your spine should be either horizontally straight like this when you're sleeping, or vertically straight. I mean, this is. We have a few more questions, so let me hurry this up. Um, hope Ms. NR, you're happy with the answer. Right. So Mr. Kumar asks us on the website. Hi, Doctor. Hi, Kumar. Pleasure. So he says that his 70-year-old mother has rotator cuff tendinitis. She cannot lift her hand more than 1 feet. Ooh, sometimes she cannot be able to wear blouses. Also, she is using a lot of tablets with no use. What should we do? Okay, this is a very common scenario, Mr. Kumar. The important thing to note is that she's 70 years old, and you say that she has rotator cuff tendinitis. This is probably, I'm assuming that you have reached this diagnosis after consulting an orthopedic surgeon who has asked for an MRI scan, which reveals this tendinitis. Basically, for our audience and for Mr. Kumar, tendinitis means that there is inflammation and swelling of the tendons around the shoulder, which are these. So these muscles can get inflamed due to lots of reasons. Uh, if she cannot lift her hand for more than 1 foot, then the situation is quite bad. She needs to come see me. I mean, so this can be because of two things. If it is because of loss of power, I mean, that means if you are able to lift your hand up and she is not able to do it on her own, that means that the rotator cuff has torn. But at the same time, if she is not able to lift her hand even with support, that means that she has got capsulitis, so superimposed secondary frozen shoulder she has because of this tendinitis. And I'm sure she must be in a lot of pain also. So she can be helped. I don't know whether she's had physiotherapy yet or not, but at that age, I will actually prefer to avoid any sort of surgery on her if possible. I'm sure she will need an injection, and steroid injection given by a specialist will definitely improve her condition. But we need to see. There could be an arthritis of the shoulder. There are so many variables which I cannot just opine about without seeing the patient. One more question we have is from Miss Sriveni. This is a very common question. She asks whether we can send videos of the exercises.
Of course we will. So this, my team tells me that this will be, the whole talk will be up on YouTube. Yes, it is. So you will have access to this talk with the exercises on YouTube. It's a good starting point, but we think that you should. These are just general exercises. Pawan has one thing or two to say. These are just general exercises which are meant as a general guide. Just don't follow them rigorously and think that you're doing proper physiotherapy, because it has to be individualized to each of you. So it has to be individualized to each of you. So you will have the exercises up on YouTube, but they are individualized. So Pawan, I'm sure you have something to say about this.
Yeah, so we can't give every exercise for everyone. We need to see what is the problem. We need to assess first, and then we will advise accordingly the prehab or rehab programs. And we also planning that, I think, doctor, we are also planning to put some exercises in our website.
Yes,
maybe in near
yes.
future.
Yes.
Yeah.
So we are just starting off. So yes, we will have some basic generic exercises.
Sorry, sorry, I lost audio again. So yeah, so of course you will have access to the video, but take it with a pinch of salt, because treat them as just a first step in your journey for getting better. And individualization of the exercises is key. Our clinic also offers online consultations for physio. Not ideal, but can be done in these COVID times. But nothing can replace a physical consultation and assessment with a physiotherapist. Next, I have a question from Mr. Rishi Vardhan Reddy. Hi, Rishi. So can you suggest how do I understand if a shoulder pain is normal or I need to see doctor with urgency? After sports, I get a lot of pain in left elbow, but I'm then okay after 24 hours. Uh, as a general rule, Rishi, if you have a lot of pain, it's not normal. Pain is never normal. It means you're doing something wrong. Either there is something wrong with your shoulder and elbow, or you might be doing something wrong to your normal shoulder or elbow. So after sports, it might be your technique, it might be DOMS, delayed onset muscle soreness, which usually gets better after a heavy workout. It might mean that you're not stretching maybe properly, which is one of the common things, common causes of pain after any sport. But pain is not normal. So there are lots of things: uh, golfers' elbows, tennis elbows, throwers' elbows, little leaguers' elbows. So these are all kind of specific elbow problems that sports person suffer from. So do not ignore it. Come see a specialist. Come see us or some specialist you need to see, just to make sure that you're not missing something and it does not get worse. We have another question. Which one? Oh, it's NR again. Thank you so much, NR. Your encouragement means a lot to us. Helpful response, he says. Okay. Can you please advise something to children related to the precautions to be taken for shoulder care? Interesting question, right, Pawan? So, I mean, children are children. So you can, even I tell my kid to correct his posture when he's attending online school. They tend to slouch in front of the computer. They tend to sit for a long time. But again, I mean, there's nothing specific for the shoulder. But in general, sedentary life is not good. They need proper exercise. They need a proper diet. They need proper rest, proper sleep. They need correct posture. Uh, so all these things are equally important. So I think for children, have a healthy, balanced, varied diet, and if possible, if it is safe, try to get some sunlight daily. Yeah, these are the general things for children, and don't get addicted to computers and video games. Over to you, Pawan. You want to add something to general advice for children?
Yeah, what you said is right. Children nowadays they are more attached with mobiles, TVs, and laptops. So they are not doing any kind of exercises. They are not playing any sports. So that itself is a risk factor. So they should be freely allowed to play in grounds. They have to play every day, and if they have any issues, then if they have any pain or any issue of any abnormality, then you immediately consult your concerned doctor. So that is my advice. So don't stop children to play.
I mean, safely.
Yeah.
Safely. Let them play, but safely. Okay, one more question from Ms. Darshan Kaur. Hi Darshan. Body weight exercises like push-ups and sun salutations, can they be done by persons with a disc bulge? Not. Yeah, of course. Pawan wants to answer. Yes, of course, by all means.
Yeah, if you have a disc problem, you can do push-ups. You can do sun salutations, means like Surya Namaskaras, right? So this can be done because disc prolapse can do back extension exercises, which is important. Whereas push-ups you can do, but you have to activate your core. So you need to understand how to activate a core. Whatever exercise you do, the main principle is you need to activate your abdominal muscles, that is core activation. That is very much important. Thank you.
Yeah, that's very good. So what I understand is be extremely careful. Make sure you're doing these exercises the right way. The technique is also really important, and these should not be done when you have an acute disc bulge, when you have severe back pain, when you are suffering with severe unbearable kind of pain. Definitely no push-ups or disc bulges. What Dr. Pavan is trying to say is that this is for long-term maintenance. So once the acute pain has come down, then you have to activate your core muscles. So the core muscles are the ones that surround your spine. So these are the muscles that actually give support to your spine. So the core muscles are really key. So they have to be strengthened. They have to be activated, and then you can do these push-ups and everything. I know. I guess that Darshan, you are having a cervical disc bulge. Yes, I guessed as much, and I think I remember seeing you as well. So be very careful about how you do it, when you do it. Make sure it is supervised. Okay, is I think sorry. Uh, can you see it? We have two more questions. Where I can't see them. Yeah, I just who Darshan. I just yeah, of course. Yeah, Pawan wants to give you some more advice, Darshan.
Yeah, if you have a cervical disc issue, uh, don't do too much cervical rotations. It is banned exercise. The cervical rotation should not be done for a disc patient. So always it is better to do neck isometric exercise, which is good for cervical. Thank you.
All right, that was quite an interactive session. I, I am truly impressed. I mean, the first interactive talk that we have from the shoulder center, I am truly impressed. Thank you so much, audience. Thank you, Darshan. Thank you. You're most welcome. Okay, I think we are running out of time. It's 5:20. We've overshot by 20 minutes despite having one speaker less. So, Mr. Narayana, hello, Mr. Narayana. Uh, will shoulder injuries take a while to recover from a diabetic for diabetics? I'm diabetic and I have been postponing to see a doctor. Yeah, everybody's been postponing to see a doctor because of the COVID. Uh, yes, shoulders are particularly for diabetics. So there are two problems, two regions of the body which are particularly troublesome for diabetics. The second one, the first shoulder, the second one is feet and ankle problems. So in general, very generally speaking, yes, you are right. Shoulder injuries, shoulder problems, they take a while for to get better in diabetics. So it depends on a lot of things. But if you compare, so there was a study done recently about shoulder problems, specifically frozen shoulder, but it also included problems, other injuries like rotator cuff tears, arthritis, labral tears, cartilage damage. And then they had two subsets of patients. One subset of patient had diabetes and the other one did not. So even though the diabetic group, they had controlled their diabetes very well, unfortunately the results were not as good as it was for non-diabetics. So in general, diabetic shoulders, the results are not that great. They are not as good as for non-diabetics, but yes, they will definitely be better. So you should get assessed, you should get treated, you should start exercises, make sure your diabetes sugar level is under control, and if you need any help, come see us. All right. Okay. I believe that was the last question. That's all we have time for today. And thank you, audience. Thank you for the lots of questions. I hope we have added something of value about shoulders. Anything you'd like to say, Pawan?
Thank you very much, each and everyone who participated in this. If you have any further doubts, anything, you can mail it us, or you can drop your questions into our website.
Yeah.
Thank you very much.
Yeah.
Thank you.
Thank you. Thank you so much. Take care. Stay safe.